So, yes, welcome back. We were doing theophylline. So, theophylline, it has a concentration dependent bronchodilator effect. Then, apart from that, what it does, it is an inhibitor of phosphodiesterase enzyme. So, it has number one, anti inflammatory, and number two, immunomodulatory property. It is not a first line drug, of course, it's a second line drug. It can be combined with steroids in case of moderate persistent asthma, and that too in children more than 5 years of age who are elder than 5 years of age. And yes, as a second line drug for mild persistent asthma, and as an adjunctive therapy in moderate or severe persistent asthma. So, whenever there is persistent asthma, mild, moderate, severe, so mild persistent asthma in case of older children more than 5 years, moderate persistent asthma along with steroids, and even severe asthma, it can be tried as an add on drug or as an adjunctive drug. Now, talking of next one, immunotherapy. So, we discussed about theophylline. Now, immunotherapy. So it consists of administering gradually increasing quantities of an allergen to a sensitized subject in order to help with the symptoms, and so that whenever further in future the person will be exposed to the same antigen, the body will not react in a very overwhelming way. So it's a sort of desensitization. So, but this is possible in very selected cases where we know very exactly well that okay, this is the particular antigen and it needs a specialist doctor. Now, coming to pharmacological management. So, in this, we have to keep into mind number one, control the symptoms. Then, number two, assessment of risk of exacerbation. So, the basic symptoms have to be controlled. Any exacerbation of symptoms has to be controlled. Number three, selection of medication, which medicine to choose, then how to give that medication, like inhalation device, and lastly, monitoring. So, these are the five components of drug therapy. First, you have to choose that, okay, symptomatic severity of asthma, symptom control, okay. In ninth edition, the first point is symptom control, that you have to control the symptoms. Number two, you have to prevent any exacerbations from happening. Then next, you have to select a proper medicine, then the proper route of delivery of that medicine. So select a proper medicine, then the route of delivery of that medicine, inhalational device, and then finally the monitoring has to be done. Now, next. So, this is a table. It is actually giving us an idea about the different drugs. So, as you know, in case of bronchodilators, we have, let's have a look at all the drugs first. So, the drugs we use: salbutamol, terbutaline, salmeterol, then formoterol, theophylline. Then mast cell stabilizers, we have sodium chromoglycate or cromolyn sodium, nido, chromal, and then ketotifen. Then an inhaled corticosteroids, I told you about beclomethasone, not preferred. The preferred ones are budesonide and fluticasone, and one is cyclosinide. Miscellaneous are montelukast. So let's first quickly have a look at the various routes. I mean, which drug is given in which form. Obviously, now use your common sense. Salbutamol, it's one of the most frequently used drugs. So it will be given as MDI as well as PDI. That means metered drug inhaler as well as powdered dose inhaler or rotahaler. So for salbutamol, we have MDI form also, as well as the dry powder, that means PDI form also. Then for terbutaline also, it's more or less same. Then salmeterol also, both forms are available. Formoterol, both forms are available. Theophylline, it is given in oral tablets. Then cromolyn sodium, it's not very cool drug, so we just have the MDI basic, this one, MDI meter dose inhaler form. Then nidochromyl. Nidochromyl is given again by inhalational route, MDIs. Then we have ketotifen. Ketotifen is an oral tablet. Or for children, we can use a syrup also or oral tablet. So oral tablet forms, you have theophylline and ketotifen. Then we have beclomethasone. So beclomethasone, again it can be given with the help of MDI and also rota caps, rotahaler form, beclomethasone. Fluticasone and budesonide can also be given by all these forms, MDI, meter drug inhaler, as well as rota inhalers. That means all the good important drugs can be given by these forms. So what are the drugs which can be given both by MDI and PDI? Salbutamol, salmeterol, formoterol. Okay, salbutamol, salmeterol, formoterol, and important good steroids such as budesonide and fluticasone. Okay, so that was about the root. Now let's see what are the important adverse effects. Now you see, ideally SABAs, the puff you have to give 1 to 2 puff a day, 4 to 6 hours apart. Okay, so 1 to 2 puff, sorry, not 1 to 2 puff a day, means whenever you give either 1 puff or 2 puff, and 4 to 6 apart means around 4 puffs a day, like that. Then through nebulization route also you can give, and rotahilar also you can give 4 to 6 hours a day, small acting ones. Now if you talk about the long acting ones, for example salmeterol, so because they are long acting ones, only 1 to 2 puffs, 12 to 24 hour apart, means 1 to 2 puffs. There also it was 1 to 2 puffs, 4 every 4 hourly or 6 hourly. Here it's only once or twice a day. Formoterol also once or twice a day. Theophylline you can give in 2 divided doses, means twice a day. Cromolyn sodium again you can give 3 to 4 times a day. Nidocromil, fine, 1 to 2 times a day. Beclomethasone 2 to 3 doses, means all that now 2 doses. Budesonide BD, fluticasone BD, cyclosonide OD, montelukast also OD. So either most are BD or ODs. Few which you have to give more frequency, cromolyn sodium you have to give 3-4 times a day, and similarly the short acting one, salbutamol terbutaline, you have to give 3-4 times a day. Now what are the main adverse effects? I think we'll continue with adverse effects in the next lecture. So we are stopping here. Thanks a lot for watching.